There is chaos at the CDC. Wednesday night, there happened to be a slew of surprise resignations following a battle between Health Secretary Robert F. Kennedy Jr. and the agency's new director. At least 4 top CDC leaders had announced their resignation after Susan Monarez was ousted. Now, the day of resignations followed a report from the Daily Beast in which a close advisor to Kennedy claimed that the administration is planning to pull the COVID vaccine from the shelves in a matter of months. So if you have not, gotten your COVID booster, you might want to consider getting it while it's still available, if you're even able to anymore. The British cardiologist Dr. Asim Malhotra, a leading advisor to the group Make America Healthy Again Action, had claimed that many influential members of Trump's family share RFK Jr.'s belief that the vaccines are more dangerous than the virus. Now, here is, of course, the reality of the situation. The COVID virus literally destroys your brain. Emergent research shows that COVID-19 can cause significant damage to the brain, leading to long-term cognitive and neurological problems. We call that long COVID, but I don't really think that description, that name really covers how damaging COVID really is for not only your body, your heart, but your brain as well. Okay, so now it shrinks your brain, specifically in areas related to memory, but also smell, sense of smell. And you've got the brain fog, but you also have cognitive decline. That cognitive decline in severe cases is equivalent to about 20 years of accelerated aging. So it can age your brain in a severe case by about 20 years. If you're a 60-year-old, suddenly your brain is that of an 80-year-old. Okay, it works just as well. Now, some 80-year-olds' brains work really well. Some, like the President of the United States, who's 79, doesn't really work so well. Okay, it's, there gets to be some problems.
I'm cognitively there.
What are you talking about?
Person, woman, man, camera, TV.
Not good. Okay. And again, even in mild cases, there is evidence that COVID shrinks your brain. That said, even with all that, it's full steam ahead. Okay, for this administration to try to take away the most effective tool we have to fight against COVID, which is vaccines. What are they gonna replace it with? What, mandatory ivermectin? What happened to freedom? What happened to choice? Republicans, they talk a great game about choice, medical choice, and then take away medical choice and medical freedom and institute their own medical tyranny. Yeah, every accusation is a confession. All right. But anyway, Monarez had been told that she was done at the Department of Health and Human Services, and soon afterwards, she hit back through her lawyers, saying, actually, no, I have not been fired, and I ain't leaving. You better come and make me. Okay. She had also accused Kennedy of, quote, weaponizing public health for political gain. Yep. That's a pretty strong statement from someone who had been previously sworn into the role by Kennedy himself about a month ago. And someone who had been nominated by Donald Trump. So very, very strong words there. Now, earlier, her lawyers said that Monarez had neither resigned nor received notification from the White House that she had been fired. And as a person of integrity and devoted to science, she will not resign. Now, the White House later on was like, oh, no, yeah, we removed her. Really? Really? Since Susan Monarez refused to resign, despite informing HHS leadership of her intent to do so, the White House has terminated Monarez from her position within the CDC. said Kush Desai, a spokesperson for Trump, speaking to the New York Times. Now, Monarez's legal team, however, Mark Zaid and Abi Lowell, said, actually, no. The White House can't do that. Only Donald Trump himself can do that. And so until Donald J. Trump comes out and says, oh, yeah, I've definitely fired this woman, she's still on. She's still on. Our client was notified tonight by a White House staffer in the personnel office that she was fired. As presidential appointee, Senate-confirmed officer, only the president can fire her. For this reason, we reject the notification that Dr. Monarez is received as legally deficient. I love that term, by the way. Legally deficient. It's like, you know, that explains a lot. Okay, that's a good descriptor for pretty much everything this White House is doing. Okay, everyone in that White House is legally deficient. Okay, but anyway, and she remains a CDC director. We have notified the White House counsel of our position. So, you know, technically she's there until Donald Trump himself comes out and says, "You're what is it? What is the thing that he's famous for saying?" Let me find it. Seriously though, I do gotta find this. Okay.
You're fired.
That's it. Pay dirt. Found it. Yeah. Now, following this turmoil, DC's chief medical officer, Dr. Deborah Oury, the director of the National Center for Immunization and Respiratory Diseases, Dr. Dmitry Daskalakis, the director of the National Center for Emerging and Zoonotic Infectious Diseases, Dr. Danielle Jernigan, and the director of the Office of Public Health Data, Surveillance, and Technology, Dr. Jen Layden, all submitted their resignations and joined with Monarez in criticizing their former boss. In fact, Monarez's legal team accused Kennedy of putting millions of lives at risk with his vaccine skepticism, while the other CDC officials cited issues with the organization's, quote, unscientific policies and promotion of health misinformation. The recent term of reference for the COVID vaccine work group created by this ACIP puts people of dubious intent and more dubious scientific rigor in charge of recommending vaccine policy to a director hamstrung and sidelined by an authoritarian leader. Daskalakis said, their desire to please a political base will result in death and disability of vulnerable children and adults. Their base should be the people they serve, not a political voting bloc. He added that the CDC was being treated as a tool to generate policy and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health. The recent change in the adult and children immunization schedules threaten the lives of the youngest Americans and pregnant people. How did this guy even continue to serve in the Trump administration when he's using pregnant people? I mean, you would think that he would have been fired day one, okay, with how little they care for those kinds of descriptors, okay? But apparently they missed a few. Wokeness. That's what they're going to use, by the way, to criticize these people. Woke. Look, hear me now, quote me later. They're going to be like, I can't believe we had these woke Biden holdovers. But wait, Trump nominated Monarez. And then and RFK is like, yeah, great. Yes, welcome. Welcome to the team. Oops. Now, getting back to Daskalakis, he said, having worked in local and national public health for years, I have never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. Bro, welcome to the Trump era. This is exactly what they do. All of that is 100% correct. Right on the money. All right. That's exactly what they're doing. It's all political. Okay. Now, Ari's resignation letter posted on social media stated this: recently, the overstating of risks of the vaccines and the rise of misinformation have cost lives, as demonstrated by the highest number of U.S. measles cases in 30 years, as well as the violent attack on our agency. Remember, the CDC offices were attacked by a gunman who claimed that they were harmed by a vaccine. Okay. Daskalakis also referenced that shooting, by the way. The recent shooting at the CDC is not why I'm resigning. He said, as he recalled his grandfather losing his life to stand up to fascist forces in Greece. Well, I am resigning to make him and his legacy proud. I am resigning because of the cowardice of a leader that cannot admit that his and his minions' words over decades created an environment where violence like this can occur. I reject his and his colleagues' thoughts and prayers and advise that they direct those people, or those two people, that they have not actively harmed. His letter ended with the hope that Health and Human Services could reverse its dangerous course to dismantle public health as a practice and as an institution. Quote, if they continue the current path, they risk our personal well-being and the security of the United States. Look, as much as I would love for them to reverse course and actually care for the American people and, you know, promote actual science, they're not going to. The odds are that this will only hasten the destruction of public health in this country. Because that's the point. Look, Trump and his friends are part of a nihilistic death cult that has adopted social Darwinism. Everything that they're doing feels like the purpose is to weed out undesirables, okay? Elderly folks that can't work. Disabled people, okay? Those with health conditions. I'm thinking that these are the people that they're trying to get rid of because they see them, the people who cannot generate profit for billionaires, as nothing more than useless eaters. Okay, that's the ideology that we are against. And I know it sounds unbelievable. I know it sounds monstrous because it is, right? It is absolutely monstrous, but it is real. It is totally believable in the context of who we have in charge now of our institutions. We have billionaires like Peter Thiel. We have Elon Musk, okay? Despite his falling out with the president, he still has a lot of influence over a lot of the people. For example, Doge, still going, okay? Not only that, but you also have, again, Donald Trump, another billionaire. They were put there by people who have no empathy for others, okay? And so, look, good on these health officials for standing up, but it's not going to change anything. You see, these people resigning just opens up these positions for Trump to put in even more extreme political hacks. Okay, that's what's going to happen. So I'm sorry, but yes, as strong as this is and as needed as the message is, I don't think the people who need to hear it are going to listen to it. And so nothing really is going to change or get better until the current leadership overall is completely replaced. And until then, unfortunately, I believe that there's going to be a lot of people who will end up suffering before that happens. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.